Hi, I'm Gary Noritz. I'm an internist and pediatrician at Nationwide Children's Hospital in Columbus, Ohio, and The Ohio State University. I work in a clinic that takes care of children and adults with disabilities. And I'm here today with Dr. Vamshi Rao. Would you like to introduce yourself?
Thank you, Dr. Noritz. I'm Vamshi Rao. I'm a pediatric neuromuscular neurologist at the N. Robert H. Lurie Children's Hospital of Chicago.
All right. So, if I'm in my clinic and I've diagnosed or we've diagnosed a child to have Duchenne muscular dystrophy, and then they get involved with the neuromuscular clinic and the neuromuscular doctors, who all is taking care of my patient then?
Yeah, absolutely. Dr. Noritz, I think one of the things that we have realized over time is there are multiple needs that a patient has. So clinic is really structured around how we can take care of the child the best possible way, but also making sure that it's not too burdensome on the family. So we've all come up as a community with a multidisciplinary clinic for children and adults with Duchenne muscular dystrophy. And it's really a sort of a one-stop shop model where folks come in and they see a lot of the care providers in the same clinic or maybe over a couple of days, but they don't have to make, 10 or 15 different appointments. So a team that really revolves around sort of a 360-degree care for a child or an individual with Duchenne muscular dystrophy, the makeup is usually of neurologists with other sort of providers that take care of the heart aspects, such as cardiologists, the pulmonologists. We also have rehab specialists, the physiatrists. We also then make sure that as we are trying to look at all the physical needs of the child or the individual, we have therapists such as physical and occupational therapists that are guiding care. The pulmonologists are supported by respiratory therapists that basically monitor how the individual's respiratory function is doing over time. We know that Duchenne muscular dystrophy has nutritional issues over time. So we have dietitians in the clinic. We also are very aware that having a child or an individual diagnosed with a condition such as this takes a toll on the family. So we have the support of the social workers who help navigate systems that can provide basic care, but also systems that interface with the care that is available through local and state governments. Other specialists that can really help are orthopedic doctors that take care of bone health issues, including metabolic bone health. We have endocrinologists that are involved, as we all are aware that Duchenne muscular dystrophy can really change how children grow, but also because they're on medications such as steroids, can often result in short stature. Mental health professionals are key and sometimes are available in the clinic or are available for another appointment to make sure that the family and the child and the individual is under their care. We have other supportive therapies such as speech. Palliative care and surgeons can also be involved depending on the stage and the age of the child and the condition that they have. All these children and individuals obviously have lots of needs, as I alluded to, and therefore any need that is not met by the clinic on the day off or on another day, obviously we involve specialists that can have clinics that cater to these individuals. I have to really stress that although there is a whole team around the family, family members themselves, parents and caregivers, and let us not forget the medical home where the child resides, which is the primary care physician who also takes care of the patient, forming a very, very important part of this multidisciplinary care model.
It's interesting. It really seems like one of these conditions that it takes a village to take care of them because there's so many needs that are there. And it must be kind of hard to orchestrate all that on the same day or and all those people working together. But I know that the families really, really appreciate it. That especially when they come from far away to the clinic, that they're able to see everybody, pretty close together and don't have to come back multiple days. In the end, who's really in charge of the care?
Yeah, that's a great question, Dr. Norris. I think the model centers around somebody who is a quarterback. Sometimes the quarterback is a neurologist. In some places, it's my colleagues from physiatry. So it really depends on where the clinic is situated and what the resources available are for that part of the sort of country or the nation in terms of multidisciplinary management.